I have a family history of Alzheimer's. My grandmother had it, my dad had it, I have it.
There is a very good chance you or someone you care about has been affected by Alzheimer's or dementia. Today, we talk to the researchers who've dedicated their lives and their work to finding a cure. And we check in with one couple navigating Alzheimer's disease and learn where they're finding hope for the future. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Caring for someone in cognitive decline can be a delicate dance. You want to respect your loved one's wishes and your feelings. You also need to keep them safe. It requires an abundance, a deep understanding of the diagnosis, energy, and time. The couple you're about to meet is on that journey right now. Here's Angie Racono.
I'm not sure I want you walking around the neighborhood unless you have your phone with you and I can keep track of where you're going.
I know where I am. May not be able to tell you, but I'll know.
Brian Janes is 64. He's been diagnosed with mild cognitive impairment and recently Alzheimer's.
I have a family history of Alzheimer's. My grandmother had it, my dad had it, I have it. And I guess if there's something we can learn that would help somebody down the road, that's worth a lot to me.
Brian's diagnosis is currently based off of his symptoms, which have worsened over time.
About a year ago, it was my mom's 90th birthday, and we had a lot of family here, and great time, and I was talking about it the next day, and he said, was I there? It's like, yes, you know. But he didn't remember.
Brian plans to take a newer blood test that detects elevated levels of proteins that characterize Alzheimer's disease. Here's why an accurate diagnosis is important. Alzheimer's is a brain disease making up 60 to 80% of dementia cases, meaning the rest is something else. A confirmed diagnosis can lead to a more appropriate treatment and understanding for families.
The frustration is big because he knows he can't remember, and he knows he used to be able to.
Yeah, remembering that I can't remember things is annoying.
Brian paints and keeps active. He works with specialists at the University of Kansas Alzheimer's Disease Research Center.
Well, I like trains.
I know.
I know.
His family knows there are many aspects of Alzheimer's that remain a mystery.
There are just those moments where nothing's there.
A blood test will be one piece of information.
There's still so much they don't know about Alzheimer's, and any information we can get about his disease, it will be better because they're coming up with so many new things right now, different treatments, and so just getting a little more information.
We're joined in the studio by two neurologists and experts in Alzheimer's disease and dementia. We have Dr. Jeffrey Burns and Dr. Russell Swerdlow. They are the co-directors of the Alzheimer's Disease Research Center, and these are the guys who've dedicated their life's work to finding a cure and figuring out how to tackle this. And we are so happy to be joined by Brian and his wife, Gay. They're joining us from their home this morning. Brian, how are you feeling this morning?
Oh, I feel great.
Good to hear. Gay, how are you doing? You were up a little earlier than Brian.
Yeah, I was. I usually start work at 7, so I made sure he was up about then, so he was ready.
Thank you for taking the time to join us. And we should clarify, you haven't needed to take that blood test after all. Is that correct?
That's correct. Insurance did approve a PET scan, so we got that done instead, and that confirmed the diagnosis.
And Gay, thank you for sharing your journey as a couple. You and Brian talked about how you notice when things are changing. Brian, do you realize when things are slipping or when there are certain things that you can't remember, or is it someone else that points it out to you?
I recognize a lot of things that or events that I just can't bring forth somebody's name or Gay will ask me, so did you take care of this, or did you take the trash out? I said, well, I don't know.
Right, that's a good answer.
And I honestly don't. I'm not being a smart aleck, you know.
Right. Gay, when we were talking a little bit before the program started, we were actually connected via Teams, and you had said you also use Life 360 when your husband goes out on
yes.
errands. So what does that look like when your husband goes out on his own?
If I'm sending him somewhere, I usually keep track of where he's going and making sure he makes the right turns. He recently retired, and so keeping him busy and finding things to keep him engaged has been a challenge. And so he joined he joined Genesis, the health club. And so there's 2 Genesis that are close by, and I told him, you know, go down this street and turn right at the post office. So he gets in the car and he puts it in his GPS in his phone, and it takes him to the other one. So I would see, wait, you're going to the wrong one.
Right.
And so I'm like, turn around and turn left at the light, and he turns right at the light. So, you know, that it helps to know where he's going.
Yes, peace of mind. When we talk about Alzheimer's, Dr. Burns, we often focus on the patient. Something that often gets neglected is the caregiver and focusing on that. And it's usually the caregiver that neglects how they take care of themselves. How common is it for someone like Gay to put their own mental and physical health on the back burner?
Oh yeah, no, very common. Actually, probably universal. We know that caregivers have more, you know, stress and strain, and that translates into real physical issues and mental health issues. And so, so we, you know, and it's a team effort. You know, there's a caregiver and a patient, and it's a family disease. And so we really work hard to coach caregivers and try to, you know, remind them, take care of themselves and pay attention to their needs, because the stronger they are, the better they can care for, you know, their loved one.
And that's so important, Gay. My dad was diagnosed with Alzheimer's, and one of the first things that the doctor said to us was, when one person has it, the whole family has Alzheimer's. So what does self-care look like for you when you feel like you're underwater?
Every day I try to spend at least half hour to an hour laying down in bed, just quiet time. And I can usually get him to join me, where take a nap, just relax and kind of recharge, reset for the rest of the day. And that
Are you
helps
ever
me.
able to enlist some help from another family member or a friend if you want to go run an errand or go get a haircut? How does that work?
At this point, he usually comes with me.
Ah, got it.
You know,
Your buddy, yeah.
Yes,
Yeah.
he wants to be involved in everything.
I love that. That's very sweet. Dr. Swerdlow, Brian talked about the genetics. He has it, his dad had it, his grandpa had it. How big of a role does genetics play in the risk of someone then developing Alzheimer's themselves?
Well, there's really 2 kinds of Alzheimer's genetics. There are some people who will actually inherit a mutation that will cause Alzheimer's disease with close to 100% probability, but that usually affects people in their 40s or maybe their early 50s, and we almost never see that. It's extremely rare. But there's a genetics of late onset Alzheimer's disease, which basically determines how you're wired and how your brain is going to age, and that will determine what your lifetime risk is going to be. The way I kind of frame it is that when you're born, you know, you're a certain distance from the proverbial Alzheimer's cliff, and you're heading towards that cliff at a certain rate. And your genes determine how far you are from the cliff when you're born and how fast you're heading towards that cliff.
Okay. And what can you do to slow down that speed?
Well, that's a good question. Some people feel, and there's a lot of data to show that lifestyle interventions may affect that course, that speed, and you know, how well you take care of yourself. You don't want to abuse yourself or make yourself run down faster than you otherwise would. And then, of course, we're trying to develop drugs that will change the trajectory. And I would say that will probably cure Alzheimer's disease when we figure out how to solve brain aging.
Right. Well, you said late onset. Is there a number for late onset, an age?
Yeah, well, it's arbitrary, and some people define it as 65, or some people define it as 60, but it's just kind of made up. But it's a designation between where if you get Alzheimer's past that age, almost certainly you don't have one of those mutations.
And is the mutation you're talking about when there was this blood test, and you told me not to get it because it would stress me out, and I got it anyway because I wanted to know. Is the mutation the APO3?
Yeah, so you're talking about the APOE gene. That's not a mutation,
Okay.
so that's a population variant. That's a gene that has 3 basic flavors in the population: APOE2, APOE3, and APOE4. And about a quarter of the population here in the United States has at least one copy of the APOE4.
Okay.
And those who have a copy of the APOE4 have an elevated lifetime risk of developing Alzheimer's. That doesn't mean they necessarily will, but they have a higher lifetime risk. And about 2% of the general population has 2 copies of the APOE4 gene. They get 1 copy from mom, 1 copy from dad. And in that case, there's actually about a 50% chance of being diagnosed with Alzheimer's by the age of 70.
Got it. And then when we talk about the gene mutation, what's the gene mutation? Or Dr. Swerdlow, do you want to take that answer?
There's 3 genes that we know of mutations in that will cause early onset familial Alzheimer's. And this is Alzheimer's where we see the disease passing from generation to generation, getting 50% of people in the family before an old age, like around in the 40s typically. So this is not Brian's case.
This is the super rare kind that you were just talking about.
And those genes are the amyloid precursor protein gene, the presenilin 1 gene, and the presenilin 2 gene. But these are extremely rare. It accounts for way less than 1% of all of Alzheimer's disease.
Okay, got that. So Brian, you shared that was it your grandma or your grandpa?
My grandmother.
Your grandmother had it, and your dad had it.
Yes.
Do you have any memories of when your dad or your grandmother were diagnosed?
I can't tell you the dates now, but I know that my dad lives in town, and we started kind of noticing that, because he knew the name of every place he'd ever been, and he could tell you how to go someplace. And I'd call him up when I was in high school and say, "Hey, Dad, I'm not sure where to go." And I said, "Look up and tell me what you see." And from the surroundings, he'd say, "Oh, go turn left and then go 2 miles and come back." So it's odd how it's different things.
Yeah.
Right.
He came over one time, and on his way back, he got lost like half a mile from here. He didn't
Your
know where he
father-in-law
was.
did. Yeah.
Yes.
And this is
And at that point, it's like, okay, this is getting scary. You need to stop driving and get a diagnosis.
because this was a guy that was almost like had a built-in compass in his in his brain, and
Kind of
that
like
went
this
away.
one.
Right, just like Brian. Dr. Burns, Brian's
Yes.
diagnosis. Oh, go on. Sorry, Gay.
No, Brian has lost his GPS. He has no idea where he is, and he used to be able to tell you the same thing.
Right. That's how we started to notice with my dad as well. He would just get lost going places, and my dad never got lost. So Brian's diagnosis, Dr. Burns, was based mainly on his symptoms. Sometimes it's really hard for family members and friends to see those symptoms when they're so close to the situation. What are the common red flags that people watching should be aware of?
Yeah, no, I mean, it's a slow, progressive disease, and people close may not see it day to day, but over time they will notice, things like, what Brian and Gay just described, which is something that Brian was always good at. Now he's starting to slip. He's starting to have problems with navigation. Other common sort of red flags, early red flags, are forgetting conversations, repeating oneself when it wasn't a trait for them before. That's a key thing, a change for that individual. So if they're now repeating themselves, if they're now forgetting what was talked about yesterday, or having poor memory of yesterday's event. And I think Gay's already described some of that in the intro and in our discussion, where it's that forgetfulness, and it's new for that individual. It's kind of unusual and new. And then the other thing is it's persistent over time. It's not just happen once, but it's something that we're seeing accumulate over time, and it's persistent and consistent.
There are types of Alzheimer's disease, which I didn't know. I thought there was just Alzheimer's and then different kinds of dementia. So what are the types of Alzheimer's disease?
So Alzheimer's isn't always just a memory disease. Sometimes it usually is. Memory is usually the initial presenting feature, but we can see forms of Alzheimer's where vision is changed, and spatial ability, what we call executive function, may be the driving sort of factor, or language problems. So there's different sort of flavors of Alzheimer's, but Alzheimer's is, under the microscope, we define it the same way when we look at the brain under the microscope. But there are various forms of dementia. The introduction alluded to that, where Alzheimer's is the most common form of dementia, dementia being memory and thinking changes for an individual that are new and that are becoming a problem. That's dementia.
Okay.
And there's multiple types of dementia. Alzheimer's the most common, but others like Lewy body, frontotemporal dementia. These are things that we sort through and think about when we're evaluating a patient.
And what kind of disease does Brian have then, Dr. Swerdlow? And how does knowing the kind help a loved one or caregiver manage it?
Yeah, well, based on the scan, one would say that this is Alzheimer's disease. Mm-hmm. But people want to know what's going on. Memory changes, and as we get older, are very insidious, and it's something that pretty much everyone experiences. And people wonder: is this just me getting older, or is this a problem here? Do I have something more? So I think just knowing what's going on, and that they're not imagining something or making it up or being overly sensitive is important and helpful. And then people, need to know two other things, which is what's going to happen moving forward, and what we call prognosis. And it may be that we can tell them, you're probably not going to change much over the next couple of years, or maybe you're going to change more rapidly. And people want to know, most importantly, what can we do to help? And sometimes there are things that we can do to help, and people need to be able to plan. So it can be very helpful to have all this context and perspective about what's going on.
Mm-hmm. Brian, you've talked about some of the things you enjoy, and we're going to get to the painting in a minute, but I want to ask you about the gym, because everything that I've heard from doctors is how much exercise helps clear the brain. What do you feel after you exercise mentally? Can you feel any differences?
I'm not sure it's a huge difference. I guess I just feel better overall, mm-hmm. which kind of helps me focus on what's important and not the rattling, I call them noises in my head.
Like the cacophony of voices and
random,
worries. Yeah.
No, just kind of, wandering thoughts.
Uh-huh.
Yeah, so he's in, he wouldn't do well with just going and working out. He's in specific classes that are structured, and that helps him. So he's tried a step class, he's tried a Zumba class, cardio strength, and also water aerobics. So, we look on the calendar every day and say, okay, what are you going to go do today? And,
He does it. Brian, I got to ask you about Zumba. I tried Zumba and I wanted to cry. I didn't know the moves. Everyone knew the dance. I didn't know I had to know a dance. How do you know the moves in Zumba?
I don't. I just kind of do. I try to follow along and look what somebody else is doing, and I may be late or I may not do that.
Yeah, and he comes home, I said, how was he? He says, it was a lot of activity.
It is.
a lot of moving.
Lot.
Yeah.
I want to talk to you about your painting. We saw you painting, and it looks lovely. Huh? Is painting something that you have newly taken up, or have you always enjoyed it?
I did a lot of art drawing and painting when I was a kid, but I got back to it recently a little more often.
Just doing things with your hands.
Yeah, that's helpful. Being physically busy and active, and rather than just sitting and reading.
Sure.
I mean, I do a little of each, but the activity helps me.
Gay people always want to help when they hear that they have a friend who has a spouse or a partner that's been diagnosed with Alzheimer's disease, and often those people don't know how to help. What do other people do for you that helps you the most, or what do they say? What are the things people can learn from listening to you?
The biggest thing is that they listen and help me when I'm trying to brainstorm different things, different activities that he can do, or, you know, I made him a calendar, a whiteboard calendar, so he writes things on it every day. What is he going to do tomorrow, so he knows when he's going to get up, when he needs to shower, when he needs to shave, you know, just an everyday calendar, and that helps. But yeah, friends just listening and helping me brainstorm is the biggest thing.
We already have some great questions coming in from our community and some comments. So if you have something you'd like us to ask or read out loud on the program, you can send it to us on YouTube or Facebook. You'll find the links right there on your screen. Dr. Burns, when it comes to the blood test we were talking about, ultimately, Brian and Gay didn't need him to get that blood test. But how does the blood test change the process of being diagnosed and treated?
Yeah, so I mean, this blood test it's new. We rolled it out, you know, 8 months ago across our health system, and it's starting to be used more and more. We use it in the memory clinic a lot now, pretty much on every patient. And so what it does is, you know, the introduction talked about how Brian was diagnosed based on symptoms alone, and really, for the last, as long as I've been practicing, that's how we did it. It's, you know, talk to the patient and the family and understand what's changed. Do a little bit of memory testing or cognitive testing to try to document that objectively, and then make a judgment call. We do some other tests to rule out things like stroke and tumor, like a brain scan, but you know, so the blood test now, what it does is it adds a dimension of that where it can tell us what might be happening in the brain. And specifically, the blood test tells us the likelihood that someone has amyloid in the brain. And amyloid is a part of the process of Alzheimer's disease, and it's kind of a hallmark signal that we may be dealing with Alzheimer's. So combining the symptoms and the testing, the memory and thinking testing with the blood test can really help you know, us be more confident that we're dealing with Alzheimer's. And just one more point about the PET scan. The amyloid PET scan is the gold standard and the best way to understand if amyloid is in the brain. That's what Gay brought up earlier, that, you know, Brian had an amyloid PET scan. That's the gold standard. That is, you know, the confirmation that he has amyloid. The blood test is a kind of a shortcut to that.
Got it.
And it's not quite as good, but it's very good.
And the blood test was being considered because Brian and Gay didn't know if insurance was going to cover that PET scan. Dr. Swerdlow, when you look at, okay, we've got the blood test, and we have the PET scan, and we have the test for the APOE genes.
APOE genes.
What is the most accurate predictor, short of the PET scan, what test is the most accurate predictor telling you if you will get Alzheimer's disease?
The most accurate test, well, it really depends on the context. So they provide complementary information, and at different times, different tests may be more useful. So when you're young, you know, you may want to know how fast you're heading towards the cliff, and maybe the APOE test is going to be more useful in giving you a sneak preview on how your brain is going to age. But when you're older, you know, you may want to know how far you are from the cliff. And you know, the blood test or even the PET scan that Dr. Burns talked about will tell you how close you are to that cliff. So you know, it's putting it within the context of memory problems, and are they memory problems that are happening within the context of amyloid plaques are present. So the different tests, the genetic test, the gene test, the APOE test, and the amyloid tests will give you complementary information.
We've got some questions and some comments coming in, so I want to get to the community comments and the questions. The first one I have is Maria wants to know what is stopping you from, or stopping the medical industry from making this blood test a common blood test that everyone has at their yearly physical?
Yeah, that's a great question. That may be where we're headed. But right now, it's actually becoming routine for people who have memory problems.
Okay.
It's not yet routine for screening and for people without memory problems, for screening and for thinking about, the future and can I get a risk assessment. And the reason why is for people with memory issues, memory problems that we think are Alzheimer's, we now have treatments that where we need to understand if amyloid is in the brain.
Okay.
We don't know if those treatments work for people to prevent dementia and the memory problems in the first place. So if you look at that group without memory changes, we're not yet there. We're trying to prove that we can do something about it.
Okay.
That's the big question: is if we know somebody's risk is high, can we do something about it?
When you say memory issues are already there, there's a lot of women in menopause who have this wicked brain fog. Does that count as a memory issue, where if they're worried?
Yeah.
Asking for a friend. But if someone watching is worried and they're feeling fuzzy, can they then say, I have a memory issue, can you test me? Can I take the blood test?
Yeah, I would say if the clinician thinks that the patient may have the early start of Alzheimer's, then that's somebody who we may want to do the blood test on. If we think it's menopause, if we're not sure, if we may want to watch for a while. Because the blood test really tells us, it's really an amyloid test.
Okay.
Is there this protein called amyloid in the brain? And if it's in the brain, then how do we interpret that how does the physician, clinician interpret that? If they have clear, persistent memory changes and amyloid, then it's almost certainly the start of Alzheimer's.
Got it.
If they don't have those clear memory changes, then people can have amyloid and actually live with it a long time and never develop Alzheimer's. So there's some nuance there, and so we do want to be careful in how we use it.
Right, because it could light a panic.
It could, exactly.
Without any plan to tackle that in place for people who are in their 40s and they don't have that genetic mutation. Marcia wants to know, how do I go about getting genetic testing for Alzheimer's disease? When is this indicated, and can knowing one has genetic markers help them do anything to delay the onset?
Yeah, boy, that's a great question. It comes up from time to time. This is going to sound kind of strange, but on a party line, we generally don't recommend that people get genetic testing to determine what their lifetime Alzheimer's risk is, for the reason that if a positive test doesn't necessarily mean that you're ever going to get Alzheimer's. And it can cause things like anxiety. There are some conceptual concerns. Could it affect maybe down the line getting long-term care insurance or something like that? That being said, there are ways to find it, what it is. I think on 23andMe, you can do it. I've had people that have absolutely worked to convince me that, look, I really want to know this, and if they understand the pros and cons, and I can facilitate that, I'll do it. But it's a complex issue, and it's, some people want to know, and some people don't want to know.
Right. And then one comment from Denise. She just wants to thank us for this discussion and says it's on target. And that's huge part and due to Gay and Brian. Thank you so much for coming forward and sharing your journey. It helps so many people. And with that, I want to get to today's takeaways. Gay, what is something that you wish you knew going into this?
I think I didn't know how much patience it was going to take, and it's a marathon. It's not a sprint. It's gonna take a long time. The changes are slow, and there may be no changes for 6 months. So yeah, it's a marathon.
Brian, what would you like viewers to know about living with Alzheimer's?
I guess the biggest thing for me is not sweat the small stuff. Just if I don't remember something, so what? Somebody can remind me, or I can go look it up, or find out more, and just keep moving.
It's great
You know, if I sit and worry about forgetting, I'm going to forget why I'm doing something about it.
Right. Dr. Swirlo, what excites you most about Alzheimer's disease research?
What excites me most?
Yeah.
Really, it's the research that's going on right here at the KU Alzheimer's Disease Research Center, where we're studying how energy metabolism contributes to Alzheimer's disease and its role and its potential targeting as a treatment option. And I think that this line of research is really going to help us understand why memory problems develop in Alzheimer's disease, and it will help explain the myriad things that go on in the brain of someone with Alzheimer's disease, and it's going to help bring us to newer and better treatments.
So then the million-dollar question, if you had a crystal ball, Dr. Burns, how close are you to finding a cure?
Yeah, that's the big question.
Yeah.
I think we will find a cure.
Like in our lifetime?
I sure hope so. And part of it depends on how quick Russ can work. He's figuring it out. But yeah, I think it's a matter of when, not a matter of if we're going to cure it.
Okay.
I think the cure will come out. It's not going to be a magic pill. It's probably going to be a combination of things that we're using to delay it indefinitely. And we're starting to make progress on that with some new drugs. I think, I guess my takeaway would be it's a really hopeful time, and this question is a hopeful question. When are we going to cure it? I think we will, but we don't know when.
Right.
But it's a hopeful time. There's a lot of changes. These new blood measures, are amazingly helpful to us. The new scans, they're relatively new, and we're now using them in patients, and that's a big deal. So there's lots of change happening. We have some new drugs that can help delay it for some people.
Right.
And so, yeah, exciting time, and I think this is, the start on the path to a cure.
And just being able to say when you find a cure, not if.
Yeah.
It's when. Thank you again to our guests, to Gay and Brian. Thank you for sharing your journey with us. And to our doctors, thank you for all the incredible work that you're doing to find a cure. And to our viewers, thank you for joining the conversation. Coming up tomorrow, can a thunderstorm trigger an asthma attack? Surprisingly, yes. We explain the study and the research surrounding thunderstorm asthma on Open Mics with Dr. Stites tomorrow at 8 a.m.